Hello, everyone. How are you today? It's Yvette McQueen, MD, a global physician on a mission to educate about health, travel wellness, and disease prevention. Had a little stumble there. So, I'm an emergency physician and travel doctor, and I help people like you and travelers to stay healthy and safe during your adventures. So, on my series this week is Dr. Tara.
Mhm.
So, we're going to discuss with her about her travels, her adventures. She has a passion for travel. She mixed it with her medicine. She's done some missions and she's actually lived outside the United States. So, welcome, Dr. Tara.
Hi, Yvette. Hi, everyone. I'm a board certified psychiatrist with a specific interest in global psychiatry and kind of cross-cultural mental health. And so it's been nice to be able to fuse those two together in the different experiences I've had.
What's cross cultural mental health?
So, kind of having an understanding and incorporating people's different cultural experiences, cultural beliefs, and how it factors into their view of mental health, their view of kind of the treatments that we typically kind of offer in Western medicine, and how can you incorporate that into the overall treatment plan?
Oh, wow.
Mhm.
Cool. Learned something today. Yay. So, when did you first notice you had a passion for travel?
I would say probably in my teenage years. My dad started working for an airline, and so we got to reap the benefits there that they give employees. And so in my kind of teenage years is when we first started traveling internationally, and that was mainly Caribbean islands. My parents are from Haiti and Mexico, but those are kind of the main countries at that time we had gone to. I didn't start really traveling further internationally, probably I would say kind of in med school. So in my mid 20s or so is when I kind of started exploring other places. And I think once that started, kind of took off from there. But I think the seeds were planted by my parents, kind of
Oh, yeah,
mid to
definitely.
late teens.
You had your passport early then, right?
Yeah.
Cool.
It's never too late, though, is what I tell you. Yeah.
So you said so you traveled in med school. What'd you do then? Or residency? You did something?
Yeah, so in my residency program, they had an international elective, and so when I trained in New York, and so that was actually a big, I think, draw of my program, because then I could get us. I think being the daughter of immigrants, but also my love of travel, that was something I was really interested in. So they had a month-long elective in my last year of residency, and I went to Kisoro, Uganda, and that
Ooh,
was an amazing experience. It's about 12 or 13 hours drive from Kampala, which we did. So,
wow.
yeah. Someone was driving us. I wouldn't even venture to try to drive there. But it was a really unique experience. It was with a DGH, or Doctors for Global Health. And it wasn't just the psychiatry residents. I was fortunate enough to go with one of my co-residents and friends. But they also had kind of the global medicine fellows kind of training there, some med students from places. And they had a clinic established, but then also kind of the main hospital. And so over the course of the month, I would say we probably did maybe 60% psychiatry and about 40% neurology. There really weren't psychiatrists or neurologists there. And so we kind of had to cover everything. And so seeing things, I had read about in med school, but also just getting to know the people and kind of in our, weekends when we weren't working, really exploring the country, which is beautiful. And I think that really kind of solidified my interest kind of in doing kind of global work. Yeah.
Okay, so that's Uganda, right? So
Mhm.
that's
Yeah.
like Central Africa.
Mhm.
And sometimes people in the older years remember Uganda was like under strife.
Yeah,
Was
with
it
Idi Amin, yeah.
yeah,
Mhm.
was it peaceful when you were there?
It was very peaceful. I felt really safe. I think that's kind of like the stereotype people have or the association they had. And I think one of the reasons I felt safe too is this was a program that had been established with the hospital where I was doing residency, and people had been going for a number of years. And kind of one of the senior residents, kind of when I had first started, had done a grand rounds about it and spoke about it. And she had gone by herself with the attending, and they had from that point kind of sent someone every year. So I knew it was a well-established program and safe. I never felt unsafe in the time I was there. In fact, at one point, we kind of our weekend side trips, we were near kind of the Congolese border. And then another time we had gone, near the border of Rwanda. And at no point in that month did I feel, unsafe or anything like that, which I think was a great experience, because I think it also helps to kind of dispel the myths or kind of negative stereotypes. A lot of people were saying, be safe. Understandably, I think they were concerned. But it was a really great experience. Yeah.
Good. So what other countries have you done missions or time in?
Yeah. So I think what kind of started inspiring the medical mission trips I have, my sister is also a physician. She does family practice. And so she had been doing kind of intermittent medical missions through the years, and I'd always hear about them. And the organization that she had done them with, the bulk of her medical missions have been with an organization called Flying Doctors of America. I think one of the things that, you're giving it a thumbs up. I agree, I give it a thumbs up. One of the things I was always kind of wary or hesitant about was, I think as a psychiatrist for medical missions, it can be sometimes difficult to find a mission where you can be of service using your skills in psychiatry. Because I think a lot of the work as a psychiatrist do requires some longevity. Sometimes there are things that are acute interventions, but typically you need time to, develop rapport and relationship and start exploring things. So she would tell me about various missions that were coming up. And I said, let me know. And if there's one where they think they could actually utilize a psychiatrist, then, I'd definitely be interested in. And they had gone to La Paz, Bolivia, and we're going to be doing work in prisons.
Right.
And so one of the prisons, San Pedro prison, which there's actually a book about it called Marching Powder. It's a really unique, I think, prison, just kind of even in the world, is kind of like its own community. And they have, division of labor and things like that. But they talked about, there was a lot of trauma, a lot of kind of undiagnosed mental illness. And so they thought that there could be, use for a psychiatrist. And so that was the first one that I went on. And that was a really kind of great experience, going in and not knowing what to expect. But I think more than anything, it was just, I was shocked at kind of seeing how it was almost its own city. So some of the people would have, their partners or their wives there with them. I saw children there that would come in to stay with them during the day. There were prisoners who were kind of the security, in addition to the officers, but ones, I guess, who had good behavior. And so they were kind of escorting us, from place to place. I think initially we were all a little bit wary of, this is a prison and we don't, in another country, we don't speak the language, you don't know what it's like. But I think very quickly I felt comfortable. We had great, interpreters. And I think it was really moving. And I think this is something I've just, in any time I've gone internationally in practice, it was really struck by, I think, how grateful people were. You don't necessarily enter medicine, looking for praise or accolades, or that shouldn't be the reason someone gets into it. Yeah. But I think I was so taken aback by how overtly kind of thankful people were. And I think people that probably by society would have been judged very harshly based on the crimes that they had committed. And I think be really scary or wary of them. And
but you always like to feel grateful, like you did something, and versus here in the United States, I mean, in the ED, I very rarely get thank you. I'm usually called names. So that's an experience for someone that's like, well, thank you for being here and actually helping me.
Yeah. And I mean, like I said, it really is its own kind of like village. They had like a printing press and things like that. And so at the end, they had given us like certificates of gratitude that they had taken time to kind of print out and personalize for each of it. I mean, things we never expected. And it really was really moving. And I think, like I said, just further work to kind of change my perspective. And I think, again, just kind of reaffirm for me kind of why I do the things I do. Right. And being able to combine that, with travel and my kind of training. And then a year later, with the same organization, I did a medical mission to Amman, Jordan. And we were working with Syrian refugees there. And that was really another profoundly, moving experience. Again, I had some reservation because I think one of the things I'm always mindful of is I never want to go and do a medical mission and just be there for myself, just to say, oh, I did something. I want to be able to be of service and, give back to people and kind of use my medical training in a
Yeah.
way that benefits them. And like I said, sometimes as a psychiatrist, it can be hard to find medical missions where you can actually do that using your psychiatric skills. But that was one of the ones that was really profoundly moving. And that was another kind of well-established mission. It had been going on for a number of years. They were working with Jordanian medical students.
Okay.
And so there, I think a lot of what I did was, psychoeducation, I think normalization of kind of the experience they have. Because I think often when there's a collective shared trauma, people start comparing trauma and saying, well, in comparison to someone who lost their entire family, I haven't lost that much. So again, kind of just doing some psychoeducation about it's still a shared experience and it does impact people. So lots of, as you can imagine, PTSD and just explaining what that was, going over some, distress tolerance techniques, things like that. And I think more than anything, kind of doing brief supportive psychotherapy, just listening. You could see a lot of people would come and leave and even, or at least for that moment, it's as if they kind of had a burden lifted. And many people would say things like, it was really helpful just to kind of talk to someone about that or share my story with someone. And I think sometimes, a lot of the times what I found is it's me kind of bearing witness sometimes to what they've gone through, because I think it's being in survival mode. So, it's not something they can kind of sit and really even begin to process. I was also really moved at that time because I hadn't expected many men to come and see me. I think culturally and quite honestly, this is pervasive, I think, in a lot of countries, not unique to Jordan. But maybe some of the reluctance they would have to see me, one as a psychiatrist, but as a female psychiatrist. And I would say it was almost an equal number of men and women. And again, willing to kind of talk about, what they'd experienced and trying to get a better understanding of why they were impacted and how could they move ahead and what are things they could do to try to make it more manageable. So that was a really unique experience as well.
So then you ran off and said you were going to live somewhere else.
Well, there were a couple of years in between. I was working in the States the whole time, and I had been doing ER psychiatry work at the time. After my experience in Uganda, had actually in residency in my last year really considered working abroad then, and had kind of met with recruiters and kind of discussed things. But one of the things I discovered kind of in the early stages was you get paid based on years of experience. And so coming just out of residency financially wouldn't have made sense, especially with med school loans. Yeah. So I kind of, it was a dream kind of in my mind, and I really just kind of put it to the back burner and didn't think about it. And about 3.5 years into doing ER psych work, it kind of started popping up in my head again of, well, what about now? Because at that point I'd been practicing maybe 5 years or so. So again, I kind of met with a recruiter and was looking. And at that time I knew I wanted, an English speaking country, one that would recognize my training, because I didn't want to have to do, years of training to kind of work there. And then also I was going by myself. So I wanted a country that was relatively safe as well. Mm-hmm. And at that time I had kind of decided, it was debating between Australia and New Zealand. And I had actually visited Australia before and really liked it. Granted, it's not the same, going on vacation somewhere and working somewhere and living there. But I was partial to that. The reason I ended up in New Zealand, it was because the recruiter was quite clear that the paperwork for Australia took a lot longer. So that alone is the reason. I was just saying, okay, then New Zealand it is. But I'm a firm believer things work out the way they're supposed to. And I had an awesome experience there. So, it was really, it was overall just a great, I'm glad things worked out the way they did. And I ended up in New Zealand instead. Yeah.
Great. So you lived in New Zealand. How is medicine different there than here in the United States?
Well, I think first and foremost, they have what we would call kind of universal healthcare. So not having to do prior authorizations, not having to worry about would my patients be able to access medicine. Whereas in the United States, you have to think about cost of medications and things like that. That being said, there is a bit of a more kind of limited formulary because of that, because, it's run by the government. One of the things, and again, this is more kind of the cultural component. I did work with New Zealand European people, but also with Maori people, people who are Pacifica from, the Pacific Islands. And I think one thing culturally that's different from the US, and particularly in psychiatry, where in medicine, there's an emphasis on privacy, but I think very much so in psychiatry, it was very rare for me to see a patient by themselves. Probably 90% of the time, I would have an appointment and at least one person, if not more, would be there. So either a spouse or a partner, a best friend,
Wow.
an extended family member, and sometimes 3 or 4 people.
So they wanted to share.
Yeah, and I think there's a big emphasis on support of whānau or family, and not necessarily blood relatives or kind of your support system. And so that was it was nice to see, because I think a lot of the times what we deal with in psychiatry is people being isolated and not necessarily having a support system. Not all the time, but often. And so, like I said, it was very rare for someone just to come in by themselves and for me to see them. That being said, you then have to kind of alter in some ways kind of how you assess the patient, things that I hadn't really had to deal with or kind of be exposed to regularly in the US, because sometimes the significant stressor in their life was the person who was there with them, and yet the patient would still want them in the room. So how do you navigate that? But also, I think the positive aspect is in terms of being able to do safety planning and things like that. They were always there in the room, and it was about how can I find that balance of, addressing the patient and their concerns and making sure they understood, but then also speaking to the family as well and helping to incorporate, them into that as well. That was something I think.
Is that taboo?
I think, I don't think it's unique to New Zealand. I think, unfortunately, I think globally, there tends to be a bit of a hesitation. I think New Zealand has been putting a lot of effort into, I think, just getting more awareness. There's kind of a saying like, she'll be right, she'll be all right in New Zealand. Like, don't worry about it, things will be all right. And so I think there's been a lot of work to kind of break that down a bit and say it's okay to get help. Some celebrities there have been very vocal about, their own experiences with mental health issues. And I think that helps to kind of normalize it. And so I think things like that are helpful, but I think sometimes there are some hesitancies and there is some reluctance at times. And again, some of it is kind of factoring in people's cultural beliefs and things like that. And how can you kind of work together to get everybody on board and a plan that everyone agrees with? Because I think without that support, I could say what I think should happen, but you really need the buy-in from the patient, their family, their loved ones. Yeah. And I think it was so evident they are much, that's crucial to psychiatry, but when you have 4 people in the room, it's much more evident there. Trying to kind of negotiate and work with everybody so everyone understands and is in agreement with it. Yeah.
Exactly. So you had to come back?
I did. So I started off saying I was going to go for a year. And then a few months in, around the time I had to make the decision, was I going to be headed back to the US or did I intend to stay longer? I knew pretty early on I wanted to stay. I didn't feel like I was done, if you will, or I wanted, more of the experience. I was fortunate. I made, really great friends there and had a good support system. And it's a stunningly beautiful country. And so I knew I also just wanted to be able to explore more. So I signed on for another year. And then I was supposed to come back mid-May, and then everything with COVID-19 transpired. And so probably within 48 hours, I was just hearing more and more things were happening. Australia had shut its borders. And then so I had a large concern that New Zealand was going to close its borders, and very soon after, and they did. So kind of at clinic one day, I was notified that all there are 3 kind of main major airlines there that fly internationally. And I got a notification that 2 of them were going to stop international flights at the end of March. And so then I got really nervous of I may not be able to leave the country. And then what do I do if my visa expires and I'm not working? And then the US had raised its travel advisory level and was kind of saying Americans abroad to try to come back because they couldn't guarantee they could repatriate you. So kind of in between seeing patients, I was on the phone with the US Embassy and Immigration New Zealand. And I think because, this is just so unprecedented and no one could give me any guarantee of what would happen if I couldn't get out. The recommendation was that I leave as soon as possible. So this was a Thursday. and I left on a Sunday.
Oh, wow.
Really unexpected. I had actually was thinking I could leave the next Wednesday, but they were saying they thought New Zealand was going to make an announcement of closing its borders. And so I left and I landed. And when I landed, my friends back in New Zealand, were messaging me and saying they just made the announcement that they're closing their borders on Wednesday.
Oh, so you actually still have been in New Zealand.
Potentially. I think there were efforts to repatriate people.
Okay.
But again, it was difficult. And I know one of my friends is German, and she mentioned there were some German expats that were having some difficulties getting back. So that's just something I didn't want to have to deal with. I think that'd be stressful enough, and I'm sure my family would have been understandably concerned. And so I just had to leave very abruptly and kind of wrap up my life, within a few days there, thinking I was going to have another 2 months or so. Yeah.
Right. Oh, okay. Well, cool. So what 3 things would you leave with the audience about things they should know about traveling?
I think first and foremost, and I think what really clinches with me was the times I had to travel from New Zealand because it's so far, and jet lag was very real. I say stay hydrated if you have long flights. So I would drink like 2 liters of water within a flight. Yeah, I have my cup here. Because I found that when I would drink a lot of water, that would help lessen the jet lag, and it wasn't as intense. Also, it kind of forced me to get up during the flight because I would be going to the bathroom. And also I didn't want to get, DVT. So that's kind of combined. What else would I say? I think I would say be flexible. I'm someone who is pretty much a creature of habit. So, I'm adventurous, but I like to kind of have things planned. And I think if I've learned anything in travel is that you have to be flexible because inevitably things change. Obviously I had to abruptly leave New Zealand. So that's an extreme example. But I think just even traveling for pleasure, people can lose your luggage or something can be closed, an attraction. And so I think just kind of going with the flow. Otherwise, I think you end up getting stressed, and it's vacation, and you're supposed to be enjoying yourself, and exploring.
But you were there 2 years and then had to leave within 2 days.
Basically. Yeah, exactly. Yeah, so I think flexibility is key. And I think, but also if you have that openness, I think you kind of just go with the flow, and that actually helps to remove some stress of just the acknowledgement of. And I think, if anything, with COVID-19, it's shown to all of us, we can plan, but things can rapidly change. So I think if you go in with that mindset, that helps. And I'm a foodie. I think my third thing would be I tend to try to look up at least 2 or 3 places, restaurants or things, or, diners or little like hole in the wall places online and read lots of reviews and get a sense. So I always like to pick out a couple of restaurants I know I want to try in an area. But I think added on to that is ask the locals, because I love kind of having that combination of, places that are well known, but also the people who live there are going to tell you kind of what is the best food and, the kind of the native cuisine of that country. And I think you always want to try that. For me, beyond just, the culture and the sites, food is a big part of what I love about traveling, and getting to experience that. So I think going, asking a local, give me 2 or 3 of your favorite places. I feel like you can never go wrong with that.
Great. That sounds great. Well, thank you, because you did bring up some points that I always do with my travelers: hydration, moving a long flight so you don't get blood clots. And I think it was Dr. Carmen termed it authentic travel.
Yeah, exactly.
Yeah, well, you talk to the locals, like, where's the best place you like to eat or to hang out with them. So that's great to know. You've had some wonderful experiences. And I will put in, you said Flying Doctors of America. Highly recommend them for missions. Last week I talked about my mission experience, my first mission experience, and it can be gratifying. I always come back feeling I got more than I actually gave.
That's been a common any of the medical missions or work I've done abroad, that's been kind of the predominant feeling.
Well, thank you, Dr. Tara, for giving us your story. Unfortunately, I can't give you any place for her to follow. Once again, she is in psychiatry, so her privacy is necessary. But we appreciate you sharing all your adventures and passion for travel. And you know where to find me, people. Okay. Yvette McQueen, MD, all social medias. And my website is YvetteMcQueenMD.com. So thank you for joining us today. I hope you enjoyed the session and gained some information because I definitely learned something. So travel well, stay safe. Peace for now.